Hello dear students, welcome back to my channel Physiology Learning. So today we are going to continue with the physiology of digestion and absorption of nutrients. In the previous videos we have seen how carbohydrate digestion happens, how protein digestion happens. Now finally we are going to understand how the fat substances are going to be digested and how the reabsorption is going to happen. So this is also a simple topic. You can read it from biochemistry also, or you can read it from physiology books. Both are almost given the same amount of information. So let's get into the topic. So digestion and absorption of fat. The most abundant fat of the diet is nothing but triglycerides. Triglycerides. One funny thing about this triglycerides is, since it cannot be reabsorbed directly as a triglyceride, we have to convert into a lot of substances. But again, ultimately inside the cell, it will go back and form the triglyceride and then transport it into the blood. Just for getting it inside the cell, we have to break it down. So let's see how we have to break it down and how they are reforming. So other fat substances are also there, but they are not huge in quantity. So majority is triglycerides. Followed by that, we have the phospholipids. And phospholipids, they are generally digested by phospholipase A2 enzyme. Whereas the cholesterol and cholesterol esterases, they are digested by cholesterol esterase hydrolase enzyme. So they play a minor role because the quantity itself is low. Let's talk about triglyceride and how it is getting broken down. So the digestion of fat, the major site of digestion happens in the small intestine. So the site of action is important. It happens in the small intestine. But the digestion starts in the saliva itself. The saliva has one enzyme which is called as the lingual lipase. And it continues to happen in the stomach also with the help of the enzyme gastric lipase. The contribution of lingual lipase and gastric lipase is very less, but they have one more important role. So their overall contribution for digestion of this substances is very, very less. But what they do is they give some additional benefit in the next step. They will obviously break some of the fat molecules and release some of the free fatty acids. But the amount of free fatty acid released by them is very low, but it is sufficient enough to stimulate one of the most important hormone. In GA hormone itself, I have discussed extensively about this topic. The free fatty acids can stimulate the hormone, that is CCK, the cholecystokinin. And cholecystokinin, many of us think its primary function is contraction of gallbladder. Now also you must have thought the same function, but its primary function is pancreatic enzyme secretion. Pancreatic enzyme secretion. That is its primary function. Now when the pancreatic enzyme secretion happens, the pancreatic lipase is going to come and it is going to do wonders, just like it was doing for carbohydrates as well as the proteins. So the primary function of this gastric lipase and lingual lipase, it's not about the digestion, but giving some free fatty acids to start the chain reaction with the help of cholecystokinin, and finally pancreatic enzymes will come. Pancreatic lipase can do a lot of digestion of the lipids. So the first step in any fat digestion, it has to be emulsified. What is emulsification? It is like adding a detergent to it so that the digestion and reabsorption becomes easier. Just like we are washing the clothes with, and you add some detergent, it reduces the surface tension and it will act like a detergent and causes the emulsification process. So the emulsification can be further divided into mechanical, wherein the churning of the food itself will cause some emulsification process. And second thing is by the chemical. The chemicals, the primary important chemical which is causing the emulsification process. Here I am not telling about the digestion, I am telling the emulsification. The emulsification process is done by the help of a bile. Again, bile secretion is also enhanced because of the enzyme CCK, cholecystokinin, which will cause contraction of the bile and release the bile that is stored. So the bile has two things. One is called as the bile salts and lecithin. Out of this lecithin does a lot of emulsification. Of course, bile salts is also important, but comparatively, the lecithin component, which is a phospholipid, will cause a lot of emulsification. This lecithin is nothing but it is also present in the respiratory system. It is nothing but it is going to reduce the surface tension there. So the bile salts and lecithin are going to work. So whenever there is a fat, because of the agitation process, the mechanical process itself, it will cause and become an emulsified fat. This emulsified fat will be further acted upon by the pancreatic lipase to the free fatty acids and to monoglycerides. So what this emulsification process is, whenever there is a big molecule of fat, And fat molecules, they will always try to combine with each other. This we must have seen it with oil also. When you put some drops of oil, they will try to join each other. So when you break them with mechanical agitation, they will break. They will break into smaller molecules like in the shown in the image. But what they will do is they will rejoin themselves. But if we have a bile substances, this bile substances, they will go and coat, and they increase the surface area first thing because of the broken molecules. Now they will go and coat so that they don't rejoin. So it is just like preventing them to rejoin. So that now this is the bile salts. So now our pancreas is going to secrete the pancreatic lipase. So now when the lipase comes in, it is finding small molecules and it can go and attach them easily and cause the breakdown of this fat molecules. So that is the overall process. So somebody is coating and preventing them from joining them, and next person will come and attack them for the digestion. So the end products formed are nothing but our free fatty acids, and we also have two monoglycerides. Now this is our end product. So any digestion, once we get an end product, then the reabsorption process will start, the fat reabsorption. Here the fat reabsorption, when it is trying to enter into the brush border of the intestine, what is happening is there is some layer of water. This layer is called as unstirred water layer. But what is the difficulty for this unstirred water layers? This is a fat and there is a water. So this fat cannot enter into the water. So we need help of somebody who can pick them up and take them near the brush border. Who does that? As you can see here, the green molecules are nothing but our bile salts. What does the bile salt do is, they will fall something called as micelle. What is this micelle? Micelle, you can just imagine like it is forming a globular structure or a wheel-like structure, wherein it is attaching itself with the fat molecules and forming a structure. Now this wheels-like structure, it will slowly go into the brush border, and what it will do, it will release this free fatty acids and monoglycerides into the intestine. The bile salts will not go inside. They have just come here to drop them. So what they will do is, they will drop them, and this afterwards the bile salts which are not entering into the cell, they will come back and pick some more fat molecules and then drop them back again. So it is basically like a ferry service. That's what we can say. This bile salts acts like a ferry service, taking products from one end of the river and dropping them to the other end of the river. So that's why this process is called as ferrying. They have given a beautiful name for it, like ferrying. It is just going to carry substances and drop them. But this vessel is not going to go into the cell. It will come back and pick more substances. So that's the beauty of it. And after that, the lumen will have some transporters. Previously, they said no transporter is required because lipids can easily pass through the lipid bilayer. But majority of passive diffusion also happens. But recently, they have found out that there are some fat transporters also. This transporters will transport the fatty acids and monoglycerides, and all of them will combine inside the cell to form the triglyceride. That's what I told you. Now we have broken down through the entire story from triglyceride to free fatty acids and mono acids. But again, some formation of triglycerides will happen. What is the importance of this is, this triglycerides can be transported into the blood. From inside the cell, they will form triglycerides, and through the process of exocytosis, they will come out and they will bind with the substance called chylomicrons. This chylomicrons later on will go into the lymphatics. From the lymphatics, they go into the blood vessels. So that's the journey of fatty acids. So from triglyceride back to triglyceride. Some of the free fatty acids can be utilized by the body directly also. So this is the entire journey of fat absorption. There are lots of diseases wherein the fat absorption, if it is not proper, what will happen? The passage of stool, it will have fat. So the applied aspect here is steatorrhea. Just like diarrhea, it's like steatorrhea, wherein the fatty substances are seen in the stools. Steatorrhea means fatty substances are seen in the stools. So this is a fatty, bulky, clay-colored stool will be seen in this patient. So what are the commonest causes? One of them is decrease in pancreatic lipase, because that is a major enzyme which is causing this. And this pancreatic lipase will be destroyed by HCl. So when somebody is having increased amount of HCl, they will decrease the pancreatic lipase. So increased HCl is also not good, because the pancreatic lipase gets inactivated in a low pH or increased H+. So that's why the duodenum has other enzymes like bicarbonate and everything to increase the pH so that the pancreatic lipase is not deactivated. Next thing is, whenever a patient is going in for some gallbladder surgery, they also can have a steatorrhea, or they are going in for ileal resection. They are going in for an ileum resection. And ileum is one region wherein the bile salts are reabsorbed. Bile reabsorption happens there. So now this patient, the amount of bile will be less. So when the amount of bile is less, emulsification will be less. So all this fat will go into the stools. Again, this patient can have steatorrhea. So these are some of the causes of steatorrhea. So this is all about the digestion of carbohydrates, proteins and fats. In some of the institutions, this question they prefer to ask in long answers also. So make sure to watch all three of them. And I hope you enjoy the videos. Thank you for watching the video. If you have any doubts, please drop it in the comment section. I'll be happy to make a video on it. Thank you so much.